Hello, my name is Cassandra Savala, and this is mine and Sung Hee's Quality Improvement Project for CAUTIme prevention by improving nurse competencies at Pomona Valley Hospital Medical Center in Force Central. According to the National Healthcare Safety Network, catheter-associated urinary tract infections, also known as CAUTI, are the fifth most type of hospital-acquired infections in the U.S. The 2021 average national CAUTI standardized infection ratio, or SIR, was 0.90. The standardized infection ratio, or SIR, is calculated by the number of observed hospital-acquired infections divided by the number of predicted hospital-acquired infections. If an SIR is greater than 1, it is indicative that more hospitals have these hospital-acquired infections than expected. The best hospitals have a SIR of 0. In fall 2022, Pomona Valley Hospital Medical Center had a CAUTI SIR of 1.469. In 2021, Pomona Valley Hospital Force Central had a CAUTI SIR of 0.79. The number of CAUTIs in the Force Central unit was 1, and the number of expected CAUTIs was 1.26. The goal of Pomona Valley Hospital is to have a CAUTI SIR of 0. Higher SIRs are indicative of decreased patient safety and increased risk of adverse events and poorer health outcomes. Patients with CAUTI can have significant pain, discomfort, increased length of hospital stay, and possibly even death. A higher SIR also diminishes the patient's experience and care of satisfaction at that organization. Higher SIRs also increase the costs of the hospital. Treatment per CAUTI incident can range from $867 to $10,197, and this can range from the patient's acuity to the hospital environment. The annual cost of the U.S. healthcare system is estimated $340 billion for treatments of CAUTI. Preventing and improving CAUTI incidences at Pomona Valley Hospital will improve the triple aim by improving the patient experience of care, improving the health populations of the area, and reducing the per capita cost of the healthcare experience. Song Hee and I conducted a literature review and found a couple of different evidence-based interventions that can reduce CAUTI incident rates as well as improving nurses' competencies and knowledge of CAUTI prevention techniques. The first evidence-based intervention is an educational program that includes face-to-face training, demonstrations, checklists, and check-off skills for inserting, maintaining, and removing indwelling catheters. In a study conducted by Ferguson, a pre-education intervention self-assessment reported that 91% of surveyed nurses were comfortable and confident with urinary catheter maintenance and appropriate indications. When tested, only 40% of the nurses were able to correctly identify cases for appropriate catheterization. Although nurses may feel like they are competent in CAUTI prevention techniques, there is a gap of knowledge in appropriate CAUTI prevention guidelines. Once a training and educational intervention was implemented, the CAUTI incident rates reduced from 45% in 18 months. Educational interventions have also been shown to decrease CAUTI rates in telemetry and neuro-ICU units. In addition to a decrease in CAUTI incidences, there was also a decrease in urinary catheter device utilization rates. Audits are another evidence-based intervention that have shown to reduce CAUTI rates. Audits can help evaluate the CAUTI prevention progress as well as proper adherence to best practice guidelines. When using daily audits as an intervention, a CAUTI SIR which dropped from 19%. The last evidence-based intervention is providing standardized protocols. In a study by Van Decker et al., standardized protocols and procedures decreased CAUTI incidences by 83% from 2013 to 2017. To assess the impact of our quality improvement project, we want to measure nurses' competencies related to CAUTI prevention. We would provide a pre- and post-test measuring the nurse's knowledge, skills, and attitudes when performing indwelling catheter care. Other potential measures for future QI projects can include measuring CAUTI rates, CAUTI standardized infection ratio, or SIR, or the CAUTIme standardized utilization ratio, which is the utilization of indwelling catheter devices. Here is some data regarding Force Central's CAUTIme incidences within the year 2022. As we can see by this graph, Force Central only had one incident of CAUTIme during February. On this slide, we have some data regarding the CAUTIme incidences of other units at Pomona Valley Hospital. As we can see, the majority of CAUTIme incidences occurred in critical areas throughout this past year. The ICU 2 had 13 incidences of CAUTIme, while the trauma ICU had 6. The goal of each unit and for Pomona Valley Hospital as a whole is to bring down the CAUTIme SIR to 0. Based off of the 5 principles of highly reliable organizations, we have a few recommendations. Pomona Valley Hospital Medical Center, Force Central, cannot ignore CAUTIme incidences even if there is only one. The team members and units should assess how to improve CAUTIme incidences at the microsystem level. CAUTIme incidences are partly due to the lack of knowledge of Pomona Valley Hospital's indwelling catheter protocols and evidence-based practices. Pomona Valley Hospital should also listen to the concerns of their frontline employees that manage indwelling catheters and find other areas and opportunities for improvement. Our proposal is to address the staff's knowledge of Pomona Valley Hospital Medical Center's indwelling catheter protocols with an educational course. Here is our driver diagram referencing our aim and our primary and secondary drivers to carry out our quality improvement project. Our aim is to reduce CAUTIme in Force Central by increasing nurses' competencies. Our primary drivers include an educational program, providing standardized practice and protocols at Pomona Valley Hospital, implementing routine huddles for assessment, and further auditing of nurses' skills and documentations to evaluate if competencies and policies and procedures have been reached. Our potential return of investment in this project is estimated to be $12,540.98. According to the Agency for Healthcare Research and Quality, the average cost of treating a hospital-acquired CAUTIme infection is $13,793. There was one incident of CAUTIme in Force Central during February of 2022. The cost of implementing an educational quality improvement project is low. Educational materials have a small financial impact. According to Ms. Alvarado, Force Central's unit manager, less than $1,000 per quarter can be covered by the unit for educational material. Our educational material is aimed to be short and accessible to everyone via a one-page printout of information or a PDF electronic file that can be shared through Google. There would be an educational intervention program that is 30 minutes, which requires staff nurses to clock in an educational meeting. This would include our pre and post survey for measuring the nurses' competencies of protocols. According to the U.S. Bureau of Labor and Statistics, the average hourly rate for nurses is $59.62. So if there are 42 nurses in Force Central at Pomona Valley Hospital, and the cost of an educational program to all the nurses would be about $1,252.02. Additional benefits that will have an indirect financial impact include improved nurses' competencies, a decreased cost of associated care to treat CAUTIme, and improved patient safety and satisfaction, which can improve the hospital's HCAHPS scores and the hospital's safety grades. The next 2 slides are our references. And thank you for watching our presentation on reducing CAUTIme by improving nurses' competencies of CAUTIme protocols and prevention techniques.